So this machine is important because this gives us an objective measure or a very precise measure telling us how much we need to feed our patients. Normally dietitians would calculate or use formulas or some surrogate ways of measuring or sort of calculating energy expenditure, and often it's more of a guesstimate. We don't really know whether we are feeding our patient to the right amount or not, just because nutrition in the different stages of ICU is very important, in the early or in the later phases as well, particularly because these patients do end up going to a ward, or when they go home they do suffer a lot of catabolism, which means they lose a lot of muscle, which affects their functionality. And a lot of this is determined by nutrition, what they receive in the ICU and even after ICU. So this machine gives us a very objective way of knowing what we need to feed the patient, so that we can alter our plans depending on what the patient needs. And it's not just a guesstimate. Eventually it will help us understand what their needs are, so that we can try and alter these requirements depending on the phase of critical illness, and then the patient actually can benefit from it eventually, but also it improves outcomes for our patients as well.